Following portion of Great Day KC is sponsored by Clarity Care.
Are you one of the millions that suffer from knee pain from osteoarthritis? If you are, you know those everyday activities are difficult, like walking, climbing stairs, or even sleeping through the night. Well, this morning we are going to find you relief with an option that you may have never heard of. Let's welcome in Dr. Jeffrey Conaway of Clarity Care to introduce us to it. Good morning, doctor. How are you?
Good morning, Tony.
Thank you so much for being here. Okay, because I'm starting to feel my youth catch up to me in regards to how much I played outside, the sports that I played. But before we get into all of that, doctor, tell us more about Clarity Care and, of course, the conditions that you treat.
Sure. I'm so glad to be here, and thank you for having me. Clarity Care, we're a medical facility just north of Oak Park Mall in Lenexa, and we have an imaging center that does CT, MRI, DEXA, mammograms, ultrasound, things like that. And on the other side, the part that I'm the director of is the treatment center, where we do minimally invasive surgical treatments, just like genicular artery embolization that we hope to be talking about today.
Okay, we are going to get into that. So how do you know if a person's knee pain can actually be treated at Clarity Care?
Well, that's a good question. So generally, we're looking for people that are having chronic building pain that hopefully has been diagnosed as osteoarthritis. And that usually is going to manifest with difficulties rising from a chair, bed, or toilet, going up and down stairs, or just the more they walk or going through a long day, they have this chronic aching or stiffness in their knees. Gotcha.
Okay, so you just mentioned what I'm about to break down, the acronym, but this is a non-surgical treatment. It's called GAE. What does that do? What does it, offer?
Sure. So for patients that are suffering from osteoarthritis and the pain that goes along with it in their knees, they'll often be treated with medications, physical therapy, joint injections with different kinds of things like steroids. But over time, as the disease gets worse, those no longer are effective. So they're left with only really one choice besides just dealing with it, which is total knee replacement. This is a procedure that actually gives them an alternative.
Okay.
And so if they're either not wanting to have the surgery yet, or not a candidate, then this can offer them treatment, and that's who we're really looking for. It's an outpatient procedure, and we go in and we reduce the blood flow to the abnormal tissues that are associated with the arthritis. They go home that day. We expect their results to happen within weeks. They'll get about a 50 to 70% reduction in their pain, and that can last for 2 to 3 years.
Nice. Okay, tell us, how does this compare to the alternatives out there?
Sure. So, so probably one of the biggest ones that are directly competing with it is that it's covered by insurance.
Oh, that's a great comparison there.
Yeah. And so most of the others have limited, if any, coverage.
Yeah.
And so also the lasting effect of it, 2 to 3 years, is a lot longer than things like platelet-rich plasma, or say stem cell injections.
Sure. Okay, that's really good to know. So my mom actually had to get a knee replacement a couple of years ago.
Yeah.
But, this procedure, what does that look like for the patients, their experience before, during, and even after the procedure?
Sure. So after the consultation and the patient thinks that that they want to have it and move forward, and I think that they're a great candidate, they come in that day, they get an IV, they go back into the treatment room. It takes about 1 to 2 hours to do the treatment. They get a small incision in their foot, where that's the way that the treatment is done. They get sedation, so they don't really remember anything.
Okay.
We come back out to the recovery area. They wake up very quickly as the medications wear off. We make sure that they're drinking and eating, can move around okay, and that they understand the instructions to go home with. They'll have a driver who will take them home and be with them for that day. They recover very quickly because the incision in the foot will be healed up within a day or two. They can go back to normal activity.
Okay.
And so over the next few weeks, they should see improvement. And over time, really between about 4 to 8 weeks, we expect their pain to get down to, on average, 50 to 70% below what they had before.
Wow, that's amazing. So in your words, doctor, why should a patient choose Clarity Care for this procedure?
So, you know, one of the things that led me to open up Clarity Care is we wanted to lower barriers to access for treatments. So it's a very easy experience. They can drive right up, walk right in, register with us, and get back and see the doctor, get the workup, and the treatment's really the same way.
Yeah.
And so that's really very kind of convenient, fast, and efficient for lots of patients, and they really appreciate that.
Nice. Well, doctor, thank you so much for stopping by. I've learned something new. We've all learned about GAE today, so thank you so much for sharing more about this new procedure that people can get.
Thanks, Tony.
Absolutely. All right, if you'd like to learn more about GAE, give Clarity Care a call or visit kcneed.com. Clarity Care is also on Facebook.